Hello, everyone. Thanks for joining us tonight. My name is Mark McAllister, and welcome to the Facebook Live Roundtable for the Ottawa Epilepsy Program. And this is our way to kick off Epilepsy Awareness Month. I'll be moderating the discussion this evening. Again, my name is Mark McAllister. I am a journalist actually based in Toronto, but have been very involved in the epilepsy community, both in the province and in the Toronto area. I myself was diagnosed with epilepsy 10 years ago, and as a result, jumped in and have taken part in a number of things in the Toronto area, both on the board of the local support organization and with the local hospital and everything that's happening here. So I'll be moderating this evening. I wanted to take a moment to introduce all of our panel guests and tell you a little bit about what our hope is this evening. Let's start with the panel guest introductions. If I can start, Dr. Sharon Whiting, if we could say hello. We're going to turn our cameras on as we go here. Doctor, how are you?
Good night, everyone. I'm in good shape. Thank you very much for inviting me to this session, Mark, and I'm looking forward to the night. Did you want me to?
As we introduce everybody, perhaps give us a sense of who you are and what you do. So everybody, I mean, you're obviously well known,
okay.
But not everybody will know who you are. So
that's right. So I'm a pediatric neurologist at the Children's Hospital of Eastern Ontario, and I look after patients with epilepsy. And I'm also involved in the transition program there.
Excellent. Next up, Dr. Katherine Muir. Hello.
Hi, thanks for inviting me to be here tonight. It's nice to see everybody. So my name is Dr. Katherine Muir. I'm a pediatric neurologist at CHEO. I work with Dr. Whiting, and I have training in epilepsy, so an epileptologist seeing our epilepsy patients as well.
Excellent. I'm going to go to Nikki Porter next with Epilepsy Ottawa. Nikki.
Hi, thank you all for joining us. Thank you, Mark, for doing this. I'm Nikki Porter. I'm the Executive Director of Epilepsy Ottawa, and I'm director on the board of the Canadian Epilepsy Alliance as well.
And finally, the man who simply wants to be known as Dr. Tad.
Good evening, Mark. Thanks for having me, and appreciate the invitation. I go by Dr. Tad because my last name is a bit of a kerfuffle of vowels, but Dr. Tad Fantaneanu is my official name. I'm one of the epilepsy specialists on the adult side at the Ottawa Hospital.
Excellent. So just to give everyone a sense of what this is about, and so we hope that you're going to get a lot from this discussion. We're going to be highlighting the efforts being made for coordinated epilepsy care and what's being offered for those living with epilepsy in Eastern Ontario and Ottawa. And if you would, Dr. Tad, if you could explain maybe overall, let's get us started with the bigger picture on the Ottawa Epilepsy Program and the overall coordination of care for people.
I think, thank you, Mark. I think what we're trying to do in Ottawa may not necessarily be different, but certainly might be novel in a few ways. We're trying to address the gaps in the care of epilepsy patients in different points in their lives. And by working together and having these different pillars within a citywide program, I think we're able to do that. We operate in silos often, and so there are the community advocacy programs or community groups, and then on the other side there are the medical professionals or the healthcare professionals. And I think really the strength here is that we're really trying to all stay interconnected with one another as part of the citywide program. And so that helps, for example, transmission of innovation. If one program has, something that they're like clinic to community that they're keen on spreading, right, and rapidly across all the other pillars, this is one way for us to do it. And so our program is composed of different pillars, as we call them. So the Ottawa Hospital is the adult pillar. The Children's Hospital is obviously the pediatric pillar. There's a joint transition program, mostly run out of the Children's Hospital. but obviously with foothold in the adult world. And then there's the community program. And we think between the four pillars, we're able to provide care to the patients in our city, coordinated care.
And as someone who lives outside of the area, I can honestly say this is something that is not taking place elsewhere. And so you're leading the way in being able to bring all those pillars together and make this happen for everyone and make it easier for everyone within the community to be able to leverage and find the help that they need. So kudos to you all. Should we go through each of those pillars? And I don't know if we'd like to start with the adult program or maybe start with community and work our way up.
Yeah, I was thinking of starting, with community and have Nikki say a few words and then go through the pediatric arm and the transition arm and then eventually end up at the adult arm.
Sure. When I started at Epilepsy Ottawa about 5.5 years ago, we weren't coordinated then. So this is something that has gradually happened over the last few years. And I think in some ways it's similar to what happens in other cities with community epilepsy agencies and the medical teams working together. It's very new for us. And I think we're seem to do it in a more formalized way than in other communities where we have a central portal that people can go and access all of us. And I think having that formalized public facing coordination, I think we need to be accountable to that. So I'm very grateful to be a part of that. At Epilepsy Ottawa, we provide psychosocial support. So we provide support services, education services. And one of our programs that I think fits ideally into this coordinated care model is clinic to community, which is on the one hand, an education program, that picks up where the doctor's appointment leaves off. We review some Epilepsy 101 information that people may have heard of or may not remember. We provide tips for safety and seizure management. And we help people understand when a seizure is a medical emergency. We often meet families in the past who have lived with epilepsy for years. I'm very sorry, I have a dog on my lap that excuse me, started to move around.
The nature of our world today, Nikki.
Yes, all right.
I apologize. We often hear from families who have been living for epilepsy for a while and they don't, every time they see their loved one have a seizure, they think that person is, and I don't mean to be dramatic, they think that person is about to die. That's a family living in terror, in fear, whenever that child or adult has a seizure. And part of what Clinic to Community does is help that family understand when a seizure is a medical emergency. So it can reduce the anxiety of the next seizure. It can reduce that fear of seeing their loved one have a seizure, and also reduce unnecessary trips to the ER, which is better for the family, better for the healthcare system. And that's just part of what the program does. So that's the kind of service we provide in coordination through referrals with my healthcare partners.
Nikki, if I could ask you,
Absolutely.
there's likely some members that are joining us tonight as a part of this. Can you give us some perspective on just how far-reaching your organization is and how many people that you consider clients or members at this point?
So we provide services in Ottawa and the surrounding rural regions. So as far as Renfrew, Glengarry, Dundas, Lanark, Stormont, anything east of Renfrew essentially we'll cover. And there are about 10,000 people in our region with epilepsy. And so we provide services for them and their
Fantastic. Who wants to take on the transition?
Okay, so the transition program exists at CHEO because we recognize that our patients, when they moved to the adult side, so at CHEO, you move to the adult side when you're age 18. And these are patients that we had been looking after for many, many years. And then they would move to the adult side to Dr. Tad, and it would be quite a change, quite a disruption for families when they moved. And also, one of the biggest issues was that the kids would be expected to assume a type of autonomy for their care that they may not have had at CHEO, because of course at CHEO, their parents were always involved. So the transition program involves children from the age of 14 until the age of 18. So it's a transition, not just a transfer. Transfer suggests that at age 18, bye-bye, you move over to Dr. Tad. Transition suggests that from ages 14 to 18, we're going to concentrate on making sure that you understand your epilepsy, that you can speak about your epilepsy comfortably. You can speak about the medications. This is the patients that you're taking gradually over time so that you can assume your visits by yourself. The other thing that's a very important part of the education that goes along with transition is the sense that with epilepsy, there are many conditions which we call comorbid conditions. These are conditions that are associated with epilepsy and sometimes have more of an impact on a patient than actual seizures. And those two important ones are anxiety and depression, especially in teenagers, where we see about 20% of our patients having either anxiety or depression. So when we set up the transition program, and originally we set it up after we got some funding and we are still, it's part of a research program to evaluate how well we're doing with the patients as they go through from age 14 to 18. But we included questionnaires related to anxiety and depression as part of our clinical care, which is where we should be in this day and age. And so the patients would fill out these questionnaires at every visit. Then we would evaluate, and it would be questions, how are they feeling? Are they overwhelmed? Do they want to talk about this with their physician? Do they want to talk about it alone? We get all this from the questionnaire, and then we address what we're going to do. And working in conjunction with mental health at CHEO, if we identify patients as having significant problems with anxiety or depression, then we give them help, which could range from, if you're having mild problems, you might discuss it with your neurologist, your social worker, or you may need a mental health, such as a psychologist or even a psychiatrist, and we address those issues as we go along. And as we have been studying these patients, we find that it's making quite an impact when we look on anxiety and depression. By the time you're coming through the program, usually you would have responded quite well.
Dr. Whiting, do you find that the majority, or what percentage would you say going through the transition need that extra help as a result of the depression and anxiety?
Right.
Myself, being diagnosed as an adult was difficult enough. I can't imagine what it would be like to know and deal with it when you're a child or in your teenage years.
Right. And so teenagers, of course, being different. So that's what we also talk to the teenagers about. And in conjunction with Nikki's program, of course, how do you talk about yourself when you have epilepsy? And how do you talk to your friends about epilepsy? How do you make your friends know when you need some help with your seizures? So all of that is a very important part. And some people find that they have no trouble. They will go to school and do a project on epilepsy, for instance, whereas other children are mortified if anybody was to find out about their epilepsy. So in our program, we have about 20% of patients having anxiety or depression. We recently looked on the patients that we're following. We're following about 200 patients so far. And what we found, though, is that the patients who are at the higher end of anxiety and depression and getting help from a psychologist have actually done well. The patients who are at the lower end have also done well. It's the patients that are in the middle that we're now concentrating on, because they are not showing in year to year that they're moving past their anxiety and depression. So right now at CHEO, we're working to see, we have got to give that group some additional help. And we're looking at lots of different ways, including apps, to address that.
There's obviously a lot that takes place before that at the pediatric level. Dr. Muir, are you the one that wants to take this on and maybe just explain what's happening at the Children's Hospital?
Yeah, sure. I can start with that. So at CHEO, we see patients with seizures or epilepsy from the time they're born until around 18 years of age when they transfer over to Dr. Tad. And so we see a huge variety of patients that have seizures and epilepsy, from sort of the kids that come in with a single seizure to the really complex epilepsy patients that try many medications and sometimes need to go on to other therapies as well. And so at CHEO, we obviously have the epileptologist there to see these patients. We also provide diagnostic imaging for these patients. So we have a 3T MRI scanner. Often we need to do specialized, more detailed MRI scans to look for the cause of their seizures. We also have an epilepsy monitoring unit. And so we have 2 beds that are dedicated to have patients come in. They come in for usually about 72 hours at a time. We run an EEG for 72 hours, characterize their seizures or whatever events they're having. And that can be very helpful for us for diagnosing and then managing the seizures. We also do diagnostic workups if patients, if we think they could need epilepsy surgery. And so our epilepsy monitoring unit is a huge part of that in doing those diagnostic workups, as well as the imaging. And then we work with our neuropsychologists to do neuropsychological assessments, especially around the epilepsy surgery. But like Dr. Whiting was saying, so many of our patients have these comorbidities, anxiety, depression. We see a lot of ADHD and learning disabilities. And so the neuropsychologist is a really important part of the multidisciplinary team that we work with at CHEO. We also, Dr. Whiting runs a ketogenic diet clinic, so she could talk a little bit more about that as like a non-medication treatment for epilepsy. And then we don't do the surgeries here in Ottawa, but we do the workup to get to those surgeries. The surgery is usually done in Toronto, and then we follow patients after surgery. We work closely with the team at SickKids. They come back to us and we do all the follow-up here at CHEO. I think that's most. Do you have anything else you want to add, Dr. Whiting? Services at CHEO?
No, I think that's a very good summary, and we work closely in conjunction with Epilepsy Ottawa.
Mm-hmm. Very good. Yeah, and a lot of those things that Nikki brought up, that those services that they offer are so important for our patients, that we see them at these clinic visits and we try to go through all of these questions, but especially at the beginning, it is so much information. And so this clinic to community program has been great for them to go over again what the physician has said, what they're supposed to do when they have seizures.
Before we get into the adult program, maybe just ask, you had brought up the fact that you work closely together, and that's what all this is about. But how often do the patients see that, or how are they transitioned from, say, the hospital, or how are they referenced to Epilepsy Ottawa, so they know that they're not necessarily having to search that out themselves?
So I try to refer all my patients I see that have new seizures on to Epilepsy Ottawa for the clinic to community program. And there's 2 ways to do that. I mean, I send a referral and then the Epilepsy Ottawa can contact them. So I get consent to send on their information, and then they're able to actually contact the patients. And then we have also the Epilepsy Ottawa contact information. So I always give that to patients as well if they want to reach out.
Before we get into the adult program, I know Nikki maybe wanted to raise something with Dr. Whiting.
Yes, I'm not sure if this is for this roundtable or for after, but I was just thinking of what you were saying about so many teens struggling with depression and anxiety. We currently have a program for adults with epilepsy and depression and anxiety, and we've adapted it for parents of children with epilepsy,
Right.
where the parents have depression or anxiety. we have been hesitant to adapt it for teens because we don't have the expertise to work with teens. I'm wondering if that's something we could possibly partner on.
Yeah.
If you want to talk about that later.
No, we can talk about it now, Nikki. I've been looking after
public negotiations.
No, I've been looking after patients with epilepsy a long time. And at CHEO, we actually tried, well, we did set up a program for teenagers working with a psychologist. But it was interesting that several of the teenagers, I guess, just didn't feel comfortable enough to come with their peers to talk about it. So we eventually didn't continue on the program. But I think now probably would be a good time, especially during the pandemic. I think it would be good. We always ask patients when they come, especially through the transition, if they have anxiety or depression, if they're interested in a group, and invariably they are not usually sure. They usually don't want to go to a group. So that's one of the reasons why we haven't explored it anymore. But I think it's a good idea to try and look on it again.
And this program is, even at post-pandemic, this program's provided over the phone. So that might be easier.
Exactly.
That's one less barrier for them.
Right, exactly.
It's amazing when it comes to the group sessions. While most people may be reluctant at first to want to open up and share their experiences, once you get in there, it's amazing what a sense of community you find and how you share those experiences with other people. Dr. Tad, why don't we go to you once again? You can explain what's happening at the Ottawa Hospital.
Oh, just like that fear of that button not clicking. Just
yeah, Zoom anxiety. Zoom anxiety.
It wasn't turning on. Thanks, Mark. So, you know, much like my colleagues at the Children's Hospital, we run similar services on the adult side. So we have different clinics for different patient subgroups. For example, newly diagnosed patients, we see them, or patients who have medically resistant epilepsies, of course, we see. And we've launched a few other clinics this year in particular, a first seizure clinic where patients who have their first seizure can be rapidly seen, get the testing they need before their first appointment, and hopefully seen in the first 10 to 14 days, which is good. It helps many things down the road for them. And then a women with epilepsy clinic that we're just about to launch as well. And that one is geared more towards women's health, and in particular, obviously, with pregnancy. And it's a similar approach. I mean, on our side, it's very multidisciplinary. We have EEG technologists, other epilepsy specialists. I'll just mention them really quickly: Dr. Reza Rezazadeh, Dr. Jendra Kale. And we work with a big team. We similarly have a monitoring unit and different EEG services, so electroencephalography services. And much like our colleagues at the Children's Hospital at CHEO, we don't yet have the ability to perform the surgeries to potentially cure some of our patients' epilepsies in Ottawa, but we're building towards that. We're trying to get to that level. If you think about, you know, the kind of geographical distribution of all the epilepsy surgical expertise, it's really where you are in the kind of southwest, right, of the province, and where we are is building, I would say, and I think those are the key elements of our program. But you've just seen the interaction between Dr. Whiting and Nikki, and just how a simple idea that burgeons can potentially, as quickly as you saw it on Facebook, spread between the different pillars, and so innovations can scale up essentially.
And you referenced as well the fact that there is an opportunity for you to work with other hospitals, organizations, not just in Eastern Ontario and in the Ottawa area. I don't know which one of you would prefer to speak to this, but there is opportunities to work with other epilepsy organizations and hospitals
Right.
in Ontario, across the country, internationally, to make sure that you're doing everything you possibly can. And and that you're using the best techniques and technology that's available, correct?
But I can speak to that, as I was president of the Canadian League Against Epilepsy and very involved in the International League. So the International League Against Epilepsy is a league in which many countries are involved, greater than 100 countries around the world. And our organization here in Canada is the Canadian League Against Epilepsy. And I think all of us on this call are members of the Canadian League. So the Canadian League invites all epileptologists as well as neurologists into one forum. So as you see, we can share ideas. We do advocacy for patients if we're having trouble getting medications, for instance, and also a lot of work in terms of our residents and fellows and teaching and education. At the international level, the world is divided into different sectors. And so we're in the North American sector with Canada, United States, and the West Indies. And there we're working on many different areas. Stigma has been a particular area that we have been working on, driving laws. And now, of course, COVID is the major area that we're looking at across the world. So it's very much a connected world with epilepsy. On the other hand, well, maybe Nikki wants to talk about, there's a patient side to the International League. There's a patient side that she may want to talk about.
Yeah, so as there is a Canadian League Against Epilepsy, there's the Canadian Epilepsy Alliance, which I'm involved in, which is the national alliance of the community epilepsy agencies in Canada. And the CEA is partners with the Canadian League Against Epilepsy. And we're also involved in the international version of that, the IBE. The
International Board of Epilepsy.
Thank you very much. So we do partner nationally and internationally, and also provincially. We are rife with partnerships in epilepsy.
We do have some questions from people that have joined us. So if I could, and perhaps this is for you, Nikki, to start. Do you need a referral to speak with anybody at Epilepsy?
No, we welcome referrals from doctors, because when someone's in a doctor's office and we get a direct referral, so we get a fax from that doctor's office, we can follow up and we find the pathway from the healthcare team to us. The most direct is with that referral sent to us. But anyone can call us up about any of our programs. You don't need a referral to even to Clinic to Community or Uplift. All of our programs you can self-refer.
And if you're in that position where maybe you're waiting for a diagnosis, you've been in touch with the doctors and the hospitals, and you have a sense that maybe this is what's happening, is it too early to reach out for some support?
Not at all. Not at all. We can help with that. We have resources. Sometimes you can meet other people who are in the same situation. The information we have won't be as definitive because there isn't a diagnosis yet, but we do have supports that we can provide.
Fantastic. Turn to the doctors now for another question. What are some of the common challenges that you see with people living with epilepsy? Very basic question. Who wants to take it?
Yes,
Let's
I can.
go to Dr. Muir. There we go.
Yeah, I can start with the children. I mean, I think when people initially think about epilepsy, obviously what comes to mind is the seizures. That is what makes you, like, that's why you have epilepsy, you have seizures. So we obviously see children and treat their seizures, but I think that is just a very small part of the challenges that this patient group faces. So we've touched on a lot of the comorbidities, so the mental health issues that Dr. Whiting has talked about, anxiety and depression. And I mean, Dr. Whiting, we see it very clearly in her transition study in the adolescents. It definitely starts earlier though, especially the anxiety you can see in much younger school age children. and then learning disabilities, ADHD, and really just behavior kind of struggling in school. So often these children have a lot of difficulties in school. And so I find after we get through the initial kind of diagnosis and settled on medications, most of my time is spent talking with families about these other things. So talking about how school is going, what are the barriers that they're facing in school to really maximize their learning for them. And then I don't go into as much sort of the social stuff. It comes up in the clinic a lot, some of what Nikki is talking about. And I think that that's probably the patients, when they're connected with Nikki and Epilepsy Ottawa, makes such a big difference for them, is a lot of these, some of the social barriers, especially as parents are getting used to the diagnosis. They're often looking for other parents to talk to about what this means and what life is going to look like now for them and their child. And so Epilepsy Ottawa is just excellent for that, for connecting with families and helping them get that kind of information and the perspective and just plan. And then from the teenagers, we talk a lot about kind of in the idea of transition, what it's going to look like when they transition away from their parents. So what is it going to look like when they're getting their first job, when they're going to university, how are they going to manage? And so I'd say, although I do a lot of medication management, probably more of what I do is all of these other things.
It's interesting, sorry, because that you mentioned the social aspect. People come to us with many concerns, but many people end up talking about social isolation, losing relationships, not knowing how to talk to friends, or it kind of being hard even for family members to understand, and not knowing anyone else with epilepsy. So something that connecting to our agency or coming through clinic to community does is it connects people to an epilepsy community. And that could be, they might be interested in connecting one-on-one with a peer mentor program, or participating in social groups, or our support groups. I think the most effective way that people have connected with our epilepsy community is our annual Purple Day party. So March 26th is Purple Day for Epilepsy, pre-pandemic, and it will return post-pandemic. We usually have a big party at City Hall in Ottawa, and there are 100 or 200 people that come. And every year we hear from adults with epilepsy and families, kids of epilepsy, talking about how important it is to be in a room where everyone there just about knows what it's like to live with epilepsy. I mean, I think one of my favorite photos is of a volunteer with epilepsy and a child comparing their medical alert bracelets. And the mom said that her son had never seen anyone who had a medical alert bracelet with the same thing on it, and how significant that was for her kid. And that happens every year. Every year we hear stories. So that kind of epilepsy community, in whatever way you can connect with it, can be so significant, I think, to our clients.
Can I ask, and I'll ask both Dr. Whiting and Dr. Tan. I have found through my own personal experience that it's not just the community program and the support organization, but I found not only my personal doctor and neurologist, but people at every level that have that ability to connect personally and to make people feel like everything's okay and you're welcome. Do you find, how easy is that for you as doctors and program directors to be able to make sure that you're still connected with those patients and their families?
Dr. Whiting, do you want to go first?
Well, the first thing that I would say is that working at the Children's Hospital is a very welcoming organization. I've been at CHEO for a long time, was the chief of staff for a while there. And so we work hard to make sure that our patients feel welcome, whatever condition they have. And that starts right from the time you're trying to get an appointment to the connections you have with the nursing staff, the staff in the clinic, and so on. And I've heard many times parents say how comfortable they feel in our waiting room, knowing that they're amongst other families with epilepsy. So I think it's important not just for the relationship with the physician, but the relationship with everybody at the hospital. And the other part of the group that's important is the family doctor. So we want to make sure that the family doctor stays involved in the child's care, because we're looking after epilepsy, but children need immunization, and they may get a broken arm, whatever else may happen. So the family doctor is also an important piece. And then of course, the Epilepsy Ottawa, and I would then say the school. The school is really important. I work quite closely with the school because we find that children, Nikki just talked about a medical alert bracelet. When I mention medical alert bracelets, I always ask the kids, well, how do you think you're going to be? And many kids will say, I don't want to wear one. I don't want to have a medical alert bracelet, because they know. Why? Because somebody's going to ask them what it means. And so we, along with the medical alert bracelet, you have to be ready to talk about it. So the school is an important piece. And so it's a community that's working with the parents and the child. The other part is that we work with parents and the children. And I specifically work with the children and the parents. You cannot forget and have the conversation only with the parents. You need an involvement directly with children. Can give their story from as young as 4 years of age. So that's how I would describe what happens at CHEO.
I'd agree. I mean, to stay involved and connected with our patients, one of the most rewarding things. It's been tougher, obviously, with COVID, the whole distance. And I don't know, I think if you had asked any one of us 10 years ago, if this is how we imagined, who knows how long the telemedicine aspect of medicine might last. I think it's here to stay, to be honest. So if you had asked any one of us, maybe, is this how you had envisioned practicing in 2021? I don't think anyone of us would have said yes. But again, trying to find that connection and stay involved in our patients' lives is important to all of us. I guess to your point earlier about the challenges on the adult side, it really is with the stigma. I think to Dr. Muir's point, you can treat the seizures as best we can and sort of even have them under great control, but it is everything around epilepsy then that becomes challenging, and that's part of the stigma, right? And so driving, getting to work, staying on top of the medications. You found something that works, but you got to remember to take them, and kind of the daily humdrum routine of life. But it is much harder to get ahead, I would say, because of the epilepsy. You can tell even just getting to work might become very difficult, and so that's somebody's livelihood. Yeah, those are all big ones.
That kind of leads us into maybe a big topic of conversation that you've all dealt with over the last year, is how this pandemic impacts people living with epilepsy as well. When they would normally have an opportunity to see each of you, to go to a program at Epilepsy Ottawa, how has this made things difficult, and how have you been able to overcome and make sure that people feel comfortable, despite the fact that they're not able to do everything that they need to do or get the support that they normally would be able to?
I think, Nikki, that one was more.
So there might be, you guys might have some different answers in terms of your doctoring. For us, to a certain extent, many of our programs have transitioned online, and we use Zoom for our support meetings and our social groups. We have started using various video conferencing to do presentations to the schools, so we can provide supports for teachers who have students with epilepsy, or we haven't received as many requests for classroom presentations as we usually do, but we have found ways to do those online, although it's been more of a challenge. And this Uplift program, which is this program, this telephone-based program for depression and anxiety, happened to show up at just the right time, because we are seeing increased social isolation and increased depression and anxiety. So it gave us an opportunity to be able to address that. But I think in some ways what's been fascinating is we've had more attendance at some of our meetings online than we do, because it's some people might not want to or can't, might not have their license and might not be able to drive to downtown Ottawa. Or for our parent support group, they're busy with dinner in the evening, and finding a babysitter and all of that to be able to get to our parent group in person is a challenge. But online, just going into the other room and turning on Zoom may be less of a barrier. So we've found increased attendance, which may be a combination of people feeling more isolated elsewhere, but also that it may be easier to access services this way. So I don't think it's going away in our services too, although we are looking forward to seeing each other in person again.
Yeah, we are. Yeah.
I would agree that on the medical side, I agree with Dr. Tad. I don't think it's going to go away. And I think, especially in pediatrics, there are some huge benefits to doing these Zoom patient calls, to actually see the children at home. So a lot of the children that we see have developmental delay or intellectual disability. They may have autism, and they struggle to come into the clinic, to wait in our wait room, and then to sit in our hospital room while we chat with their parents. And so I've really liked on a lot of the Zoom calls to see these children sitting and having their snack or playing with their toys, and really get to see them in their natural environment at their best. It's been really nice.
Yeah. I would agree that the pandemic has had its pluses, and especially in mental health. Pandemic has made a change in mental health towards going online. They're able to see many more patients, and mental health services online actually have taken off and increased in, there's many more services available now for people online with mental health.
You have another question from the people that have joined us. Is this coordination between community epilepsy agencies and healthcare teams, is it new? Is it a new concept? Or is this also happening in other communities, in other areas as well?
I think it's happened to a certain extent in other communities. Agents, you, Mark, I think you experienced some of that in Toronto. From the Epilepsy Program to Epilepsy Toronto?
Yeah, I think so. I think, to be honest, what you've created here seems that much more succinct than what I've experienced. Although, again, my personal experience in dealing with the neurology department at Toronto Western Hospital and the direct communication that takes place with Epilepsy Toronto certainly exists. Especially through the coordinators and the people that are running the program. So it's good. But from what I've observed from afar, despite the fact that my background says I'm there, it seems like this is certainly much more coordinated than experience elsewhere. So I have to give kudos to you.
But Nikki, you would say though, the concept of clinic to community started in London, Ontario. And it was studied in London, Ontario by the group, the Epilepsy London, working with the London Children's Hospital and the London Academic Center for the Adults. Wouldn't you agree, Nikki?
Absolutely. So the agency in London, who I used to work for, they used to be Epilepsy Support Center, now they're Epilepsy Southwestern Ontario. They developed it because they and the Epilepsy Program at London Health Sciences Center recognized the need for this coordination. But there was some difficulty I think, this is my impression, getting those referrals. So they created a program to connect patients from the clinic to the community. And we've been fortunate enough to be able to bring it here.
Mm-hmm.
Fantastic.
Yeah.
I wouldn't mind getting you guys to plug the website, explain what exists online, and how people can use that as a tool to make sure that they have access to it.
I think the website is meant to give people an overview of all the programs in one place, and then serve essentially as a launching pad to these programs' individual websites and services. And it, as Nikki mentioned, it highlights that, you know, we all do communicate with one another. We're all connected. And it's, instead of parsing on Google different information or, you know, different links, and it's often hard to know who's responsible for what, you know, services are provided by whom. This is one way to kind of bring it all under one umbrella, and then have the patient be able to just quickly from the same website access the individual sub programs or pillars within the epilepsy program, and the citywide epilepsy program, I mean. And so patients will find resources there, you know, educational materials, and then links, direct links to Epilepsy Ottawa, to the community program, to CHEO and the pediatric program, to CHEO's very nicely arranged transition materials and the transition program, and then as well to our own website at the Ottawa Hospital on the adult side for the epilepsy program that we run.
And Tad, what's that website address again?
It's www.ottawaepilepsyprogram.ca.
That's funny. I just heard somebody recently say they don't have to use the www anymore.
That's exactly why I stopped.
And yet they still do.
I froze and I was like, I shouldn't say it because it gives away the age, but I said
I was just gonna say, you're dating yourself, young man.
Yeah, I heard it from a comedian, like in a comedy show.
Nikki, you and I had spoken before this. You had mentioned something about the Uplift Workshop. Can you mention that, or is it something we discuss at this point?
Sure. So another program that people can self-refer, or our healthcare partners can refer to us, is the Uplift Program, which is an 8-week workshop for people. We have 2 streams. We have one for adults with epilepsy who also have depression or anxiety, and we have one for parents or guardians of children with epilepsy, where the parents or guardians also have anxiety or depression. And if this all works out, we might have a 3rd stream for youth with epilepsy.
Right.
The workshop is a mindfulness-based cognitive behavioral therapy program, where people meet for an hour a week on a teleconference over 8 weeks. And they're taken through, they learn different tools, mindfulness tools, to help them manage depressed thoughts. And it was studied by EPLINK, which is the epilepsy research arm of the Ontario Brain Institute, in a study called EPUP. And they found that there was across the board, a decrease in depression and levels of depression after people took this program. So we're very proud to be able to provide it here. And it's facilitated, each group is facilitated by 2 people. We have a mental health professional. So we have a registered social worker on our staff who co-facilitates. And also, just as importantly, there is a person with lived experience on co-facilitating as well. And we've gotten really good feedback. We did 2 groups at the end of 2020, and we're running 4 groups right now. We have additional groups starting in May. And some people it helps with their depression, but some people are finding they're using the techniques to manage anxiety, and it's helping reduce their seizures as well. There's no research on that, but anecdotally, that's what some of the participants have mentioned. But I think everyone has, including the co-facilitators, have found it really helpful and useful to deal with the anxiety, not just of epilepsy, but living in these times.
That's fantastic. The idea that there is another way to approach mental health and the mindfulness aspect. There's also physical health. We've got a question related to that as well from somebody who's watching as we speak. Says, I'm a personal trainer. I have epilepsy, and so do a good number of my clients. We've seen great results for clients physically, mentally, and emotionally. Is exercise something you believe helps people with epilepsy, and do you recommend it often?
I don't recommend it enough, to be honest. I think more because of our current way of life, I guess, this past 12 months, but absolutely. And there's even lots of research to back it up, especially on the cognitive side, that exercise and cardiovascular exercise in particular helps to maintain and cognitive functions, which often memory is a big component of patients with epilepsy that they say isn't always working so well. And so, yeah, no, 100%, absolutely.
And we have some resources that talk about this as well on our website, or if anyone wants to get in touch with us.
Yeah, and I'd also say to make sure that the school does not exclude the children from any of the exercise programs, the gym programs, etc., because of epilepsy. We have to advocate for that because they should be included because exercise is an important piece.
Do you find that a big obstacle to overcome, that maybe there are some phys ed teachers out there that are a little more reluctant because of the possibility of a seizure in their mind, or not wanting to risk that child as a result of getting involved?
Exactly. That happens sometimes. And it can also, not only does it, the child doesn't get any exercise, but it really increases the stigma when everybody else in the gym is getting involved in what's happening in gym and that child is not able to take part. That should not happen. And I know Nikki talks about that when she discusses the issues with the school.
Yes, yes. One of the things, just go back to clinic to community for a moment. One of the things that's great about the program is that the clients can guide the conversation, so we can see what their most pressing concerns are, and we can adapt the resources and personalize them. And often for adults, it's often about work. They're concerned that they'll lose their work, so we have employment support. For families, it's often about physical activity, either at school, being kept out of gym class, or should they ride their bike? Should they run around with their siblings and play tag? And so we can, with those families, talk through risk management. Can they ever swim again? You know, these are the what does life look like with epilepsy? And we can help those families find a balance between kind of, you know, safety, risk management, and still having a full life with epilepsy, because it's very possible. I think it's one of the reasons people leaving the program end up walking out much more confident in their ability to manage their seizures, but also to live well with this diagnosis that they started out being so afraid of. Is that we can hear what those concerns are and come up with strategies for them, work with them to create strategies so so they can have full lives.
We've got 5 minutes left, 4 minutes left before we wrap things up. So I wouldn't mind just going around the table one more time and ask you for your final thoughts before we do wrap this up, and what you want people to walk away from this discussion with. Dr. Whiting, do you want to start?
Yeah, so what I want people to recognize is from the discussion here today that you are a partner in your care or your child's care. And when you work with us and Epilepsy Ottawa, we will try to ensure your child has the best possible life, including seizure control, medication, school, transition, as possibly as we can make it. That's what I hope.
Dr. Muir.
I hope that people walk away realizing that epilepsy is more than just having seizures, and that taking care of epilepsy is more than just the physician giving medications, that epilepsy can affect your whole life. But we have systems in place and teams in place to try to address all of these different aspects of epilepsy care and how epilepsy affects your life, to really try to provide the best quality of life we can for every child.
Nikki.
You guys have said it so well. I think that I want people to walk away knowing that there is support for them, that whatever their concerns are, you have a team behind you here who can help find some answers and work with you to come up with a plan and find those answers.
And finally, Dr. Katherine.
And the only thing I'd add is, you know, as this program continues to grow and gain a foothold in the city for good, I would like to think that there is, in the not too distant future, also a way for us to break down a lot of the stigma, at least locally. And so the goal would be the same, to help people lead the fullest lives possible if they have epilepsy. And there's a few more initiatives that we're going to be working on as a team, as a group, citywide, to try and help make that happen.
A cliffhanger to leave it all off. There's more things to come. I like that.
More to come.
Exactly. If I could add to, as somebody who receives the care both from my doctors and from the support organization that I've been involved in, it's important for everyone to know that there are others living the same experience as you. And so through all of this, through the support you can get, through the hospitals and different programs, there's other people to lean on as well that are going through exactly what you're going through. If you are able to get involved and experience that, that's one of the biggest things that you'll get from some of this as well. It certainly was for me to know that there are others out there. And you can very quickly become friends with as well, and this will become a big part of your life. Anyway, we are counting down. So I wanted to say thank you to each of you and to Nikki for inviting me to take part as well. Remind everybody that the website is there, and you can reach out to any of the organizations that have been involved today.
We'll put the website in the description of the event, of the Facebook.
OttawaEpilepsy.ca. Don't worry about the triple W. And with that, we'll say good night. Thanks,
Good
everybody.
night.
Thank you.
Night.
Thank you.
Thank you.